John, I read in the introduction to your book, The Real CDC, that you fully lost hearing in your right ear when you were a little boy. And you got, I think, an injection in, what was it, 1968 or so against the Hong Kong flu. So I guess there was a flu vaccine. Is that correct?
No, actually. Everybody kind of makes that mistake. They did not have a flu vaccine for the Hong Kong flu. So what they did was prophylactically, they gave kids injections of antibiotics, and they mixed streptomycin and penicillin. And that's how they learned in 1968 that you can't mix the two, otherwise it causes deafness in small children. And I was 4 years old.
Oh my God.
And there were, I don't know, hundreds or thousands of kids who were deaf. And I was lucky because I only lost hearing in one ear. A lot of kids were totally deaf.
Wait a minute. I've never even heard about that.
Nobody's ever heard of it.
That's crazy. Hundreds of thousands of kids here.
No, not. I said hundreds or thousands. Sorry.
Oh, okay. I just said hundreds of thousands.
No,
oh my
no,
God.
no.
Okay.
Sorry, but
hundreds. That's
I'm not sure of the exact number, but it was a lot of kids. So I say hundreds or thousands because I don't know.
Unbelievable. So they injected this combination of two antibiotics into little kids without having done any trials?
Yeah, there's no trials in combinations, right? So if you're going to give drugs, you should check out the combinations and interactions between and among those drugs you're giving. They just decided, well, got to inject them with something, otherwise we're not going to make any money. So I didn't even have the flu. It was prophylactic. It was a prevention.
That is completely idiotic. I mean, because this whole concept, you inject somebody with antibiotics, and then maybe what 5 months later you might get this Hong Kong flu, or you might never get it. Well, if you get it, even if you get it a month later, the antibiotics are not going to do any good anymore.
Doesn't do anything.
This is awful. Oh my goodness. So wow. So you are not vaccine injured, but kind of you are injured. You are medically injured, definitely, but only because they didn't have a vaccine. That might have.
A vaccine, I might be dead.
Exactly. That's what I wanted to say. Who knows what would have happened then? But so you are totally deaf in your right ear since you were 4 years old.
Yes.
Wow. Do you remember that?
I remember the blue carpet in the living room, and the phone rang when I was 5. And my mother said, I picked up the phone in my left hand, and my mother said, "You're right-handed, put the phone in your right hand." I said, "Phones don't work in the right hand, Mom." And then she took me to the doctor, and then they figured it all out.
So you didn't even really notice it unless you were on the phone.
Well, what happened was, I probably shouldn't have left out this part. I was visiting my grandparents, and my grandmother actually died that year. So it was right around the time she was dying. And I was screaming in a lot of pain. My ear hurt so badly. And I was screaming and screaming. And my mother came in, and she was waiting and waiting. And then she said, okay, she put her coat on to take me to the hospital. And what she told me was she put her coat on, came in the room, and I had fallen asleep. And so from screaming in pain, and then I fell asleep, I didn't have any pain. I woke up. I didn't tell anybody anything. I was just 4 years old. So it was probably within a few months I had turned 5. And that's when she noticed back at home in my house that she noticed that I picked it up with the wrong hand. So it was the pain after the shot. And then between that and a few months later, she figured out I was deaf in one ear.
Did you notice?
I don't know. I was 4. I can only remember like flashes of memory, the carpet and the bedroom and the bed I was in at my grandparents'. I don't remember much else.
Okay. Well, this is really a little bit off track, but this is not even really. This is very, very interesting, and pretty horrible. So, but yes, first a few words about you. So John is an electrical and systems engineer, and he has a master's in business administration, and he obtained all official Massachusetts death records from 2015 through 2023. And I think now you have them until 2024. Is that correct?
Yes, for Massachusetts, I have through 2024. Yeah,
Awesome. So you have them for Massachusetts from 2015 to 2024. Okay. And then you matched them against various records.
that's
And by
correct.
doing that, you revealed massive fraud by the state and by the CDC in overcounting COVID deaths and then hiding COVID shot deaths. So welcome, John.
Thank you. Thanks for having me.
John, do you mind if I read a very interesting passage from the introduction of your book, The Real CDC?
Not at all. Please do.
Okay. Okay. So,
I
and
wonder
by
if
the
I'll
way,
I wonder if I'll remember it. I haven't looked at it in quite a long time.
yeah, you will definitely remember this passage. I have no doubt about it. So, the whole title of the book is The Real CDC COVID Facts for Regular People. And by the way, CDC here is a play on words, the real CDC. So that's you. That's Coquin de Chien. By the way, how do you pronounce your last name? It's so French. I have no idea how to pronounce that in English.
Well, I mean, if you're looking at the European spelling, the original spelling is the former King of Belgium, King Baudouin, Baudouin. But
Okay.
when Jacques Baudouin came to the by way of Nouvelle-Écosse or Nova Scotia, and then my family traveled up the St. Lawrence River over centuries, the spelling changed because they were illiterate. So my name doesn't exist in France, and so we say Baudouin in the United States, Baudouin, but in Canada they say Baudouin, which is the
Okay.
pronunciation of the original spelling. But in France they would say Baudouin, which
Beaudoin, right.
yeah, nobody says that, not even here, not in Canada, nowhere. So
So CDC stands for Coquin de Chien, which means something like a mischievous dog, right? A coquin, that's like an affectionate expression in French for I don't know, a child or a playful child playing tricks on someone, for example. I'm not so sure that officials at the CDC would call you by that affectionate term. What do you think?
no, but if you look at the book title, the D is lowercase, and people have one person was actually angry at me because she said it was a mistake and it should be capital. I said, look above it. It says Coquin de Chien, de, in France, de, DE, lowercase. So, yeah, but yeah, CDC will not like me.
No, definitely not. They say, "Oh my God, that damn frog. What's he up to now again?" So something like that. Anyway, here comes the passage. So, in the introduction, during the first weeks of COVID, I ran math operations on CDC data to determine if the news media was telling the truth or misinforming. So that must have been in March 2020. One of the first data sets I analyzed came in two files: weekly counts of deaths by state and select causes 2014 to 2018, and weekly counts of deaths by state and select causes 2019 to 2020. The years 2014 to 2019 would define a baseline of normal mortality. My early work with these two online files revealed that the 2014 to 18 data file was incorrectly assembled. The discrepancy was evident because the pneumonia and influenza numbers did not add up in some of the cells. I wrote to the CDC keeper of that specific file, whose email address was on the screen. After sending him an explanation of the issue, I received no reply. Instead, the 2014 to 2018 file had disappeared from the website. About a day and a half later, the 2014 to 2018 file reappeared. I still had no reply via email. However, when I rechecked the file for the inconsistency I had discovered earlier, it was gone. The file data had been altered. The cell data itself was changed without any posted explanation. I was taken aback. The CDC just changed official historical data after an email from a random citizen. How can they just do that? These are public records. The point here is that I lost trust in the CDC cause of death data in that moment. I became a COVID skeptic right at that moment. This is what motivated me to continue data studies in order to truth test the narratives being fed to us by news media and politicians. So that's the end of the passage. And data studies you did, eye-opening ones. Tell me what you did, how you did it, and what you discovered.
Well, I haven't heard that that beginning in quite a long time. I tend to avoid it because people say, well, do you have the file? Can you prove it? Like, no, I'm just telling you what happened and why I got into this. I was not an anti-vaxxer, or I didn't really care about this stuff before. I was living my life, and it's just, it set me off. I'm an engineer, and when you mess with truth and numbers like that, it's very upsetting because a lot of people can die. I've been involved in projects where, if you change the tolerance on a variable of whether it's tensile strength or the resistance in a circuit, people can die because if it goes into a medical equipment or goes into a nuclear missile or an airplane, so it really bothered me. So I went to, I sued the governor over the mask mandate in the late May or early June of 2020. So within a couple of weeks of him putting the mask mandate in place in Massachusetts, they asked for delays, and I thought the longer it delays, the more people will be on my side. So like, sure, go ahead, delay it. And they delayed until November, and then they issued a new order. They rescinded the prior order, issued a new one, and they changed the order for Massachusetts with an exception. That exception was specific to my lawsuit. And my lawsuit was, you're depriving me of receiving free speech from others because you're covering their mouth with a mask, and I can't see their lips move. And in order for me to hear, I need to see people's lips move. And so they were so afraid of that being a First Amendment violation in the United States. That's a big, big thing, the First Amendment. So he rescinded the order, reissued a new one, Order 55, with an exception in paragraph 2B, which is by and between people hearing impaired don't have to wear masks. So I didn't have to wear one, and no one speaking to me had to wear one. And therefore, they issued a motion to dismiss, and my case was dismissed because I no longer had a complaint. There's nothing for me to personally complain about because the mask mandate didn't apply to me or anybody speaking to me.
So you went around during COVID without a mask. You went to the supermarket and all sorts of other public places without a mask. How often did people stop you and say, hey, where's your mask? To put your mask on?
Well, you can't tell by the camera. I'm not a huge guy, but I'm also not a small guy. I'm a little over 6 feet tall, 200 pounds. And when somebody at Costco, when I was shopping for groceries, yelled, wear a mask, and I turned around, I said, was that you? And the guy started going away from me with his carriage. So I turned my carriage around. I said, hey, say it to my face. Turn around and say it to my face. So he just kept walking. He was like afraid of me. So then a manager came up, and you know what I had to do is I had to put a mask on so that they would cash me out for all the stuff that I had bought. So they wouldn't take my transaction unless I put a mask on. So I put the mask on, I paid my money, and then I took my mask off. And I didn't have my mask on while I was shopping. I didn't have my mask on from the cash register to the exit door. I had to put the mask on so I could pay.
Despite the fact that you told the person at the cashier that you had this medical exemption for wearing a mask?
Yes, they didn't care. Yeah.
Wait, they didn't care? I mean, legally, they were in a very weak position there.
They were, and I really wanted to sue them. And I wrote a letter to them. I was all ready, and I was just too busy. I went to law school after I sued the governor because I'm not a lawyer. And I wanted to know how to do it right. Apparently, I did it right to begin with, but I went to law school for a year, and then I got kicked out for not getting the COVID vaccine. But back with regard to the masks, a couple more stories. I'll try to be quick. I was at the post office to mail something. I'm in line, and somebody said, wear a mask. I said, I have an exemption. So I get to the counter, and a woman says, excuse me, sir, you'll have to wear a mask. I said, I have an exemption from the governor. She said, okay. About 5 people behind me, a guy says, you're not going to service him, are you? He has to wear a mask. And
wow.
They started, another guy, there were 2 guys yelling. There were about 10 people in line. So I paid my money. I mailed my thing on my way out the door. One guy said, you're a sick man, and gave me a dirty look. And I looked at him. He had a full beard, like Santa Claus beard. I mean, he had a beard. and the mask is sitting on top of the beard with all the air going through. I mean, to have a guy, that's the guy who yelled at me that I'm a sick man. And then lastly, I was playing in an over 56 soccer league. I had turned 56 in 2020. And so in the fall, I was playing in the soccer league on, we have artificial turf here in the United States. So it's kind of hard, and it's harder than grass, you know. Um, the referee came up and said, "Excuse me, you have to wear a mask." I said, "I have an exemption from the governor." He said, "Okay." And he walked away. So we started playing, and the other team said, "Where's your mask?" And I said, "I have an exception from the governor. If we have to wear an effing mask, you have to wear an effing mask." And they were swearing at me while we're playing. The ball is in play. I'm running around, and they're swearing at me and yelling at me. They put me to the turf 3 times on a full sprint at 56 years old. Both my knees, the skin was gone. I had scabs on my knees that were like 8 centimeters by 8 centimeters for over a month. It took the skin off both my knees because I went down 3 times, hard fouls from behind, screaming and swearing at me. And my own team said to me, "John, can you just wear a mask?" Because they didn't want to get in a fight. They wouldn't fight for me.
Wow. I mean, this is awful. I mean, didn't they want to know, didn't they ask you why? As you said, I have an exemption from the governor. So the first question, I think some people would say, well, first of all, show me your exemption, because anybody can say that. And then why do you have the exemption? You say, oh, well, I'm deaf in 1 ear. And then, okay, that settles it, right?
Yeah. Now, Cornelia, they didn't care. They were just angry. They were angry because I wasn't wearing one, and it was the thing to do. And Massachusetts, where I live, there's a place, what is it? Carnegie Mellon University has a thing called the Delphi Institute. And the Delphi Institute made probably tens, if not hundreds of thousands of phone calls. And they checked out mask compliance is one of the surveys they did. And Massachusetts was by far number 1 in mask compliance. And the county that I live in was number 1 in Massachusetts. More
Oh
than
my
90.
God.
I am in the dead center of the most masked compliant place in the United States.
Oh, gee, I didn't know. So Massachusetts got the first prize in mask compliance, and you lived in the area where it was even the prize within Massachusetts?
Yes.
Unbelievable. But the fact, did anybody ever ask you to show your exemption?
No, there's nothing to show. I mean, I could show them the Order 55 under COVID-19 emergency mandates.
Oh, you didn't get some sort of piece of paper saying that John Beaudoin is exempted from wearing a mask because he's deaf in 1 ear? You didn't get that?
It's not me. So I was trained in strategy for sales, which is the same as military strategy. You learn different things, and one of them is it's called a fragmentation strategy. Another theory is multi-point. You're attacking from multi-points, or you're picking off fragments. You go in and you pick off a piece until you've weakened them enough that you can go frontal. And I figured that if I could just get hearing impaired people, and the way the rule was written, the Order 55, if you had 10% hearing loss and walked into a classroom with 30 people, nobody had to wear a mask. Get one person with a 10% hearing loss based on the way they wrote that. So if you could just get a few people to not wear masks and everybody else stopped wearing them, then everybody else would say, well, if that classroom isn't wearing them, I'm not wearing them. And the whole thing would fall apart. It would all fall apart. But because Massachusetts was so happy to wear masks, my plan didn't work. But at least I tried. And that was my fragmentation strategy.
Yeah, that was a good plan. Plus 10%, that's so little. I'm sure you can find lots of people who have 10% hearing loss. Just round it up. If it's 6%, you'll round it up to 10%.
Well, I just made up the number 10%. My point is, all it said was hearing impaired.
Okay. And, all right.
10% is hearing impaired.
Well, I mean, who's not hearing impaired? We are all hearing impaired once in a while. So, but that's amazing. So people could have just said, I have an exemption from the governor. That's it. Leave me alone. I don't have to wear a mask.
That's all you needed to say. That's all the law. All you needed to say is, I don't have to tell you. In fact, it was actually against the law for them to ask you what was wrong with you.
No kidding.
Yeah.
Interesting. Interesting. So that's amazing. Okay. Very, very interesting. Wow. Yeah. Oh, that whole masking stuff was so completely ludicrous and awful. I remember I had I hated these. I just hate the whole thing was just so crazy. Everything was crazy. But so I got a mask. It wasn't even a mask. It was so thin and so porous that it was completely translucent. You could actually see through it. You could see my mouth. You could see through the thing. And I was wearing that, and nobody ever complained about it. And sometimes I wouldn't wear one at all. People never complained to me. But the one time somebody complained was in a plane when I entered in this non-mask into the plane. The steward the steward said to me, "Oh, you have to put a mask on." I said, "No, I have a mask on." He said, "No, you have to put this other mask on, this one, because your mask is translucent." So he had noticed, and 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 then kind of to comfort me was, "Oh, you can just put this other mask on top of your mask." What an idiot. I mean, unbelievable. Anyway, um, okay, but so tell me about tell me about how everything started, how you decided to get the death certificates for Massachusetts and what followed from that.
Okay. So I went to law school for a year, and that took a lot of my time. And before I even went a day to the school, I said, I got a shot when I was a kid because it says here I have to take the COVID vaccine when it's available. I can't do that. And he wrote back to me, the director of admissions of the law school wrote back an express written form. Don't worry, you're over 30. You don't have to get it. Nobody's going to ask you if you got it, and nobody from this school is going to be first in line for it. So I went to school for a year. And then Joe Biden became president, and everything changed because the vaccines don't work under Donald Trump, but they do work under Joe Biden, right? So they threw me out of the school because I wouldn't get the vaccine, and I sued them. Um, that I, that I won the appeal. It was dismissed. Then I did the appeal myself, and I won. So I'm in the middle of suing the school still, 4 years later. But after that year of school, when I got kicked out, I had nothing to do. So I started doing some more data analyses, and I don't like to do things that other people are doing. If there are already, 100 scientists or 10 data analysts or, a lot of statisticians already doing something, why am I going to do it? I mean, it only takes one competent person to run some numbers and then maybe a couple people to verify they didn't make a mistake. So I look for things that other people were not doing. And I don't believe in statistics. I really don't trust them, don't believe in them. So I was going to the gym one morning, and I heard that a 7-year-old girl died from COVID in January of 22. So 5 months after I get kicked out of law school. And I thought to myself, well, for all the data that I've seen, there's no way a healthy 7-year-old girl dies from COVID. Doesn't happen. Hasn't happened. There's not a single one. And so I asked for her death record. They wouldn't give it to me. I did 8 different public records requests for all kinds of stuff. I ran them through other people, so my name wouldn't be on all of them because they would have said, "Oh, this guy is just bothering us. Throw it in the trash." And the
But
one,
wait a moment, John. The death records are public, right? They're
uh,
or not. That's always
no,
what I
not well, they are in Massachusetts, so
mhm,
every state is different. A lot of Europeans have to realize that our states are like European nations. They're
mhm.
sovereign. We are the United States, and we do have a set of federal laws, and there's a lot of federal overreach going on into the states now. But for all intents and purposes, the states are sovereign. They have their own sets of laws. So the death records depends on the state that you're in. There's 50 to 70 years in most states. And what I've learned is there are only about there's at least 4 states that they're not private. And I'm in one of those states, Massachusetts. So they just gave me all the records. I asked for, so I did these public records requests through other people. They wouldn't give me her one, but they gave me 420,000 for the whole state. So I ended up
Wait,
getting it.
that doesn't make any sense, right? I mean, first of all, they should have given you the death record of the little girl. Her name is Cassidy, I think,
Yes,
correct?
that's
Cassidy's
correct. Yeah.
death record. And they should not have withheld it from you. That was illegal.
Well, uh,
I would
yeah,
say. I mean, if it's
they
public, it's
withheld a
public.
lot.
So who cares who asks?
They withheld a lot of things.
Yeah.
Only one of the 8 requests came through, and it was the one that was all the death records from 2015 through, at that time, it was January of 2022. So, yeah, I get the whole database. Even though they turned me down for hers, it gave me the whole thing, which included hers, which was kind of weird. And then I asked, I was kind of scared. Like, did they give these to me by accident? You know, are they going to take them away? Let me get them offshore as soon as possible. So I sent them to a guy in England, Joel Smalley. I said, Joel, can you please write the first article for me? And he said, yeah, but I'm not just going to do it. You have to show me the emails that they actually came from the state. This is real data. So I gave him a chain of custody email directly from the state of Massachusetts, so that he knew that it wasn't just me. They were really the records from the state. And when he was comfortable, he wrote an article, and he looked at all cause deaths and the excess deaths that were occurring, and then the COVID deaths that they were counting. And he said Massachusetts has basically doubled their COVID death count. They lied. And he came out with the article, and then 2 weeks later, and everybody can look this up, 2 weeks later, and it's either late March or early April. I think it was late March. Massachusetts changed the COVID death count. They dropped 4,081 from the COVID death counts. Oh, we made a mistake counting. It was in the news. You can Google it. It's in the news. Still there. 4,081. They reduced it. I think at that time we might have had 18 or 20,000. I mean, how do you just drop 20 to 30% of the purported COVID deaths just like that? Oh, we made a mistake. It just shows how fraudulent the counting was.
So again, when did they do that? Reduce the numbers?
It had to be March or April of 2022. Yeah.
Okay.
Yeah.
Okay.
You could be anybody listening can look that up. You'll find it says 4081. I know I got the number right.
Yeah, that's crazy.
Yeah.
And
So
the reason given for that was what exactly?
Oh, we changed our counting method.
Wait a minute. Yeah. So what does that mean?
Yeah. What does it mean? That's a good one. What does it mean? It means we get caught. We're going to reduce the number. But the reality is, I mean, 90% of the COVID deaths were not from COVID.
Mhm.
But back to the little girl. I'm sorry. Back to answering your question. When I got that record, when I got all the records, she's the first one I looked at. And it indeed said that she died from, and here's the quote, and there's only one thing listed in part 1, which is the causes. The contributing conditions are in part 2. And I'll just tell you those were, it was asthma, fungal and bacterial pleuritis. But in part 1, the causes, it's only one thing. Complications of coronavirus 19 viral infection. That's all it said. Complications of what? You die from COVID, but no pneumonia, no this, no that. I mean, what do you mean? If there are complications, tell us what they are in the death record, please. I mean, I would like to know what she died from. So I thought to myself, let me go look in VAERS, see if I can find any record. So I've got Massachusetts. So I filter on Massachusetts in VAERS. Then I filtered on 7-year-old, and then I filtered on female. So I get Massachusetts female 7-year-olds. It came up with like a bunch. And there were three deaths, I believe. But then I thought, wait a minute, what if I know VAERS records are input sometimes, and they're not allowed to be updated, or at least they don't tell us the update. So only the original record goes in. It's like, well, what if she didn't die by the time the record was made? So I looked at 7-year-old female Massachusetts without the Y in the died column. And sure enough, I found Cassidy, and it said she was injected on the 13th of January with her second dose. The first dose, it said first dose on there was started vomiting in 5 minutes and vomited for 8 to 10 hours. So then the second dose that the record is about says January 13 injected.
So this is unbelievable. She got the first dose. She starts vomiting 5 minutes later and vomits straight for like 8 to 10 hours. So that's clearly vaccine related. I mean, clearly it's 5 minutes later.
Yeah.
At least, so in a case like that, how can the doctor, how can the parents, how can anybody think it makes sense or it's a good idea to give her a second dose? That's just incredible.
Do what everybody else is doing and do what you're told to do. That's the way some people are. Most people, as we know, are compliant. The between the Ash conformity test and the what's his name, the Milgram experiments.
Milgram experiments,
You
yes,
know,
right. I
the,
mean,
the,
was she, do you know whether she was vaccinated at school? Was there some sort of max vaccination drive at her school?
well, I don't know, but I don't I don't know about her specifically, but I do know that the vaccine bus was parked in front of that school that week. And I know that from somebody who has a child who drove up to that school and told me, I was just at that school, the vaccine bus was there that week.
Okay, because that means that whoever vaccinated her probably was some sort of a nurse, that her doctor probably didn't, if she probably had a pediatrician who didn't even know about the vaccination, right? So
Yeah,
there was really nobody in charge, no medical person who would have said, no, absolutely, you cannot get a second shot of this vaccine because you had probably a pretty very severe, who knows, maybe life-threatening reaction to this vaccine, and you cannot possibly get a second shot. There was nobody like that, and the parents, who knows, and they might not have
yeah,
suspected.
I would like to believe what you said, which is, they didn't know. The bus came up and she was in the class and the kids in the class lined up and they get their shots. I would like to think that they didn't know that she had that reaction to begin with in the first one. But in the second one, it says
Well,
terrible.
they must have known. She vomited for 8 to 10 hours, so she must have known.
Well,
They must have
the,
known,
the
right?
mother the mother must have known, right?
Well,
But
yes.
I don't know about the people in school if they were told. I mean, did it happen? I don't know. I mean, I try not to blame if I don't really know.
Well,
But
that's
yeah,
very nice of you, but I think yeah, that's very nice of you, but, clearly things went terribly wrong here.
yeah, yeah. So in the
But by the way, John, you can find out now about Cassidy because I interviewed Albert from Versuver recently, and he told me that since, I don't know, I think since, was it May 2025? Not long ago, um, VAERS changed the updates policy. So the VAERS system used to publish updates to original reports from 1990, when VAERS was created, until 2011. And then they stopped. They completely stopped making any updates to reports public, which means that you couldn't tell whether a person, let's say a doctor submits a VAERS report a day, a week or so after the injuries, and there's no way of knowing what happened to that patient. Did the person survive? Did the person die? But since the spring of this year, they are now publishing all updates, all the way back from, or going possibly all the way back to 1990, if there were any updates after 2011. But Albert says it's a very chaotic process. They release a bunch of records, and I asked him, well, hopefully they start from the present going back, because those are the most important ones, right? Not the ones from 1996 or something like that. And he said, no, they don't do that. It's complete. It's a complete chaos. Some are really old and some are newer, uh, but they are coming. I don't know how long it's going to take. So at some point you will see an update to Cassidy.
I'll definitely go and look. So just to finish her story, she took the second shot on the 13th. She had terrible abdominal pain, 103-degree fever, didn't have a bowel movement since the day prior. So that was 2 days after the shot. So that's 3 days total. From one day prior, the day before the shot was her last bowel movement. And then day of the shot, day after, and 2 days after was the report on the 15th. And so that's where the report ends, on the 15th. But I have a death record of Cassidy Baracka, 7 years old, Massachusetts, who died on the 18th of January. And all it says is complications of coronavirus 19 viral infection. So if it's the same girl, and since I have all the death records in Massachusetts and every 7-year-old female, and I matched them all and none of them match, only Cassidy matches, and she got injected on the 13th, died on the 18th. I think it's her. I sued the governor, the public health commissioner, the chief medical examiner, and 4 individual medical examiners to not only get her record, but also I have a number of other records that are fraudulent. They I would have said they're false statements, and it's not proven that they're fraudulent. Originally, I would say that, but once they've been notified, and they've been notified for 3 years because I sued them, that's notification. They should have fixed the records that are all false statements. They didn't. So now it's fraud. So
Mm-hmm.
Massachusetts has been committing fraud as a matter of custom and practice every single day when they write COVID on death records when it's not COVID, and they omit vaccine as a cause of death when they know it's the vaccine. And she's not the only one. I've got other records.
Yes, you got lots of records, in fact. But to come back to her death certificate, so the person who certifies a death certificate, that's that can be the doctor or some sort of assistant to a doctor. Who else?
So there's basically 3 people who can sign off on death records. The medical examiner, which is an employee of the state, or they're working under contract to the state. That's a licensed medical doctor, physician here in Massachusetts. Also, the physician attending at time of death. So if you die in a hospital, a lot of times, many times, the doctor who's attending to that patient at the time of death will fill out the death record. And then they started to allow, I don't know when they started, but in Connecticut, it's advanced practice registered nurses, APRN, are allowed to do that. And in Massachusetts, nurse practitioners are allowed to, there's different designations. So the kind of like extra nurses that have taken extra classes, and some of them can prescribe medicine, drugs, and they're not doctors, but they're kind of halfway between a nurse and a doctor. They can also sign off.
Right, right. So whoever that person was, and you probably have the name of the person who
Michelle
certified the death.
Matthews. Yeah,
Okay, so you
she's a named defendant in my lawsuit. So I sued her.
and she is, if I remember correctly, that's not the only time she wrote this, the complications from COVID. There are other death certificates that she certified.
But you really did read my book.
I did.
Yeah,
Yes.
so that phrase, because I have all the records, I can do searches not only on the codes that represent causes of death, I can also do string searches of words and phrases. And the phrase complications of coronavirus 19 viral infection was only used by Michelle Matthews, and she used it many, many times. And many times when she used it, there were no other causes of death listed. So, like, did all those people die from vaccines? And she called them all COVID deaths?
Mhm.
Or, some of them, I swear, were just, car accidents. In fact, with other medical examiners, I caught them, like Janice Gravetti. She's also a named defendant. 19 of the 21 I had at the time. Now I think there are 23 COVID certified deaths that she made. But at that time, when I sued, she had certified 21 COVID deaths. 19 of them had nothing to do with respiratory on the death record. There were blunt force trauma to the head, blunt force trauma to the torso, car accidents, old ladies falling down the stairs. There was fentanyl overdoses, and there were other things that really had nothing to do with COVID. So she was adding COVID to the death records because I think somebody told her to. We won't find that in any written policy because they're very careful to not leave a trail of evidence legally. But I believe if I were to get them in a private interview and it was anonymous, I think they would admit to me that, yeah, we were told we had to do so many COVID deaths, and it drove up the COVID death numbers to make society afraid and go get the COVID vaccine.
So you say that you suspect that she was told by someone at the hospital to write as cause of death that it had whatever
Yeah,
complications with COVID, which is also a very strange. I mean, if you on these death certificates, the cause of death has to be really specific, and complications with COVID, it doesn't really tell you anything. Or complications from COVID, what does that mean? What are these complications? It doesn't help you. That's not a cause of death. Complications. What are
yeah.
the complications? So that's also very suspicious. But so you said you think somebody in the hospital told her. Now the hospitals, of course, got all sorts of financial incentives to have lots of people who died from COVID because they got all these bonuses for treating COVID, but also people dying from COVID. They got a death bonus of, I don't know how much money, but they made a huge amount of money. Talk a little bit about these financial incentives that the hospitals had.
Sure. So in this specific one, though, Michelle Matthews is a medical examiner, so she's not at the hospital. She's in Boston. I think she's in the Boston office. They have a few offices, but the central place where autopsies are done are in Boston. And so that was Michelle Matthews in Cassidy's case. But the hospitals are highly incentivized to add, not just add COVID, but to use a certain treatment protocol, certain drugs, use this drug, not that drug, because if you use this drug, we'll get $200,000 for this patient. Yeah, I'm using the right number. $200,000 just to run remdesivir through somebody's veins based on a positive COVID test. Because you can get them into the ICU, you get the bill up to $1 million. And the NCTAP program, New COVID Treatment Add-on Payment Plan, under CMS, which is Centers for Medicare and Medicaid Services, if somebody were to type in their browser right now, NCTAP space CMS, hit enter. The first thing that comes up will be that New COVID Treatment Add-on Payment Plan. Scroll to near the bottom, and you will see something called Veklury, and that's remdesivir. And there's a 20% adder for the entire hospital bill if you run that drug through somebody's veins. Also, baricitinib, same thing. And that was November 2nd of 2020 for remdesivir. That's when the kidney failure started. We can get into that later. Paxlovid and molnupiravir, those two were incentivized in December of 21, a year later. Kidney signal goes up even higher after that. The point is, you're absolutely correct. Put just the right COVID on it, the hospital gets money from the CARES Act. The doctors weren't personally incentivized, from what I heard. One doctor up in New Hampshire, when I was testifying for a bill that I wrote for New Hampshire, trying to make a law, he said, well, I don't remember getting any bonus for writing COVID. I was like, yeah, okay. I guess you don't know the system. The system is the hospital administrators lean on the doctors. They coerce them. It's like, you better start writing COVID or your hospital privileges, your ability to use this hospital are going to go down. There's a lot of, so the solicitation from the act to the hospital to make money causes the hospital to coerce the doctors. And now you have a lot of COVID being written. The other incentive you mentioned, there's $9,000 to the family. That was added later. That was Alexandria Ocasio-Cortez was all happy and went in front of a camera and said, look what I did for you. I got you $9,000 funeral expenses for COVID. So if a family has spent their life savings and they're going broke because their child has cancer and their child dies of cancer, they get nothing. But if a kid, or if an old guy gets hit by a car and they write COVID on a death record, they get $9,000. So none of it makes any sense. So they were incentivized. The pay plan defines the behavior, is what we used to say. These are behavior modification techniques that you learn when you come up with variable compensation plans. If you're putting together a compensation plan for a corporation, this is what we did in business I was in for 30 years. You incentivize certain things on the variable comp. A lot of people are just salaried, right? That's fixed compensation. But salespeople, marketing people, and many companies that want to be progressive, they create a variable compensation program and they give you metrics to meet. You hit those numbers, like if you can vaccinate 95% of the workforce, everybody gets a bonus, right? Those types of things. So the behavior modifications are within the CARES Act and the NCTAP out of CMS. And none of it was to solve any disease. Now you think about it, how is throwing money at something going to solve anything? Oh, because everybody's out of work and the businesses are shutting down. Yeah, you shut them down. You did that. And the money's, I mean, everybody was happy to get their $600 check. Like, yeah, but it cost me $20,000. I don't care if you give me $600. The whole thing is just nuts when you think about it in context. And so the behavior modifications from the acts, which the lobbyists wrote the stuff that gave, the CARES Act was written in 2018. 2 years before COVID. It was finalized in 2019, and all they did was change a few variables in March of 2020, and they passed it as a law. Well, why did they write it in 2018 if they didn't know COVID was coming? Everything is a scam. Sorry, I went off on a lot of tangents there.
Right. So, yeah. So you made a lot of really interesting points. So I want to start with this. You talked about the doctors that didn't. The doctor in a hospital doesn't make money by writing somebody died of COVID when that person actually didn't die, and the doctor knows this. But you said the administrators, of course, they exert pressure and tell them, you better write this, or it's going to be personal consequences for you. You probably don't want that. And I think this is absolutely correct. And I talked to someone who used to work as a doctor. He doesn't anymore, but he used to work as a doctor in a hospital. And when we discussed COVID and what happened to the doctors and how they went along, with treating people with remdesivir, seeing that their patients die, intubating them, seeing them die, and continuing to treat them, and they say, how is that possible? How can they continue it? And most of them did. I mean, not all of them, but a lot of them did. Um, how is that even possible? And he said, well, it doesn't surprise me in the least because they were already primed before COVID. And he explained to me as a doctor in the hospital that you had to interact with your computer. So let's say you had a diagnosis for a patient, and the computer, the system would suggest certain treatments that, were, I don't know, whatever best practices or whatever it was. And he said that for him personally, what he experienced was that if he had been an autonomous doctor, he would have chosen certain medications, certain treatment protocols, etc. But the system told him to do certain other things that he didn't really think were a great way to treat that patient. But he said he had no choice because he couldn't even start treating the patient if he didn't input certain fields with certain things that were suggested to him. He couldn't even advance in the stupid software. And he said that he was forced to do certain treatments just because of the way the system had been set up on purpose. And he said that was such a horrific experience that he got out. He stopped practicing as a doctor because he said he couldn't do it. And that was all in place. I don't know for how many years before COVID, but it was already there. So doctors were already kind of used to being coerced or nudged into certain treatment protocols and not really feeling like they made the decisions anymore, but somebody above them.
I can explain that. And I also, if you get to near the end of the book, I go through that. And what happened was the Canadian Healthcare Act in the mid 1960s incentivized universities to come up with new kind of methods. McMaster University was paid a lot of money by the Canadian Healthcare Act to come up with a lot of research papers that would enhance the scientific method for how doctors treat patients. These papers became very popular in North America. And by 1981, the term evidence-based medicine was coined. And by 1992, every North American medical school, every United States, Canada, probably even Mexico, everybody was using what they call evidence-based medicine. I call it EBM. And any doctor educated after 1992 is told, you treat them by the evidence, the evidence, the evidence, the evidence. But what they're told is the evidence is from the NIH research papers, which turn into CDC recommendations. And so it used to be that your doctor would look you in the eye, ask you questions, and take notes, right? That's when we grew up, that's what doctors did. And now they're typing into the little, I call it the laptop god on the wheelie table. They're typing into the laptop, and half of them aren't even looking you in the eye. And it used to be that doctors would know if you're lying because patients lie. It's like, have you been eating eggs lately? No, I don't. They have too much cholesterol. I know I'm not supposed to eat eggs, even though eggs are great for you. I eat two eggs every day.
They are. Absolutely. They're totally safe to eat. Yes, they're good to eat.
Forget about that cholesterol BS. I'm just saying back in the day when they told us things were bad, people would lie to their doctors. And, if a doctor's looking at you, he can kind of figure it out if he's a smart guy. But now they get their heads turned. The laptop god on the wheelie table tells them how to treat you. And here's an example that I use in a lot of discussions. you grow up in a place, you have certain minerals in the water, you have certain microbes, bacteria, things like that that you grow up with in that area. There are certain foods that you grow up with in that area. You have certain genetic propensities, whether you're descended from people in the Iberian Peninsula or, the UK or Turkey or whatever. Um, People have different reactions to different foods based on their genetics, the minerals in the land and water that you're drinking, and all the microbes that you encounter. So there's you as a person and an individual, and that's the person that's the patient standing in front of the doctor. Should he treat you based on knowing everything he knows about his experience and knowing about you as an individual? Or should he listen to the paper that was written halfway around the world in India with different food, different water supply, different microbes, and just go based on the average patient? Now, I wrote a Substack article called "A Short Story About Bill," and he's a doctor. I won't get into all the details. Every doctor that's read it said I was spot on. It's exactly what happened. And what I basically write in there is a doctor will opt to save his practice, save his career, not get sued, not go before a medical board. He will do what the laptop tells him to do rather than doing what he knows to be a better treatment. So he might give you a 5% chance of dying that he has no liability for because he did what the laptop said. So he has no liability, rather than giving you a 1% chance of dying, knowing the specific individual circumstances of you as the patient. If he were to really think, he might take a different treatment plan where you have a 5 times better chance of survival, 1% relative to 5%, right? And if you multiply this across all of society, what EBM has done is it's driven unnecessary deaths up much higher than it otherwise would have. And they tell you that it's great because it's centralized medicine. Anything centralized leaves errors at the margins of normalcy. So if you're outside the normal, right, you're a little bit different than most people, you might get misdiagnosed because the doctor isn't thinking about you. He's doing what the laptop told him to do.
Wow, that's really interesting what you just said, and it reminds me of a part in your book where I think it was in your book, or did I read it in one of your articles on your Substack? Maybe, I don't know, but doesn't matter. So you wrote about a physician. Where was that? A physician in California, and he was asked by a Silicon Valley executive on an open social media audio forum. Imagine that there were thousands of people listening, right? And he asked him this hypothetical question: if you vaccinated 20 patients and 10 were dead in a week, would you stop using that vaccine? I mean, it's a no-brainer. Of course you would stop using that vaccine. I mean, what else would you possibly do? And then you write, I was shocked that the question was even asked. What a dumb question, right? I found it insulting to the physician, but then my shock was overtaken by the physician's answer. The physician stated that he would have to consult the most recently available literature before making that decision. What the
Yeah,
heck?
that that was Steve Kirsch, the guy asking the question. I don't know if you know who Steve Kirsch is.
Yes, I do, of course.
We were on a
Right.
Twitter space, and Steve Kirsch was on there. I was in there with a few of us, and Steve's like, "Wait a minute, what if?" The scenario you just said, what if 5 of your patients died right after you gave them the shot? Would you still continue to give the shots? And I'm thinking to myself, Steve, what a stupid question. And lo and behold, the guy said, I have to consult the literature. Like, he refused to say that he would stop giving the vaccine. I can't remember his name. It was either, I think it was a 3-letter last name, and he's Chinese, and he's in San Francisco.
Oh my
Um, I,
God.
I can't remember. It wasn't Cho. I wish I could remember his name. This guy, I looked him up. I mean, he's crazy. Imagine going to a doctor like that. But yeah, that was
Well,
firsthand.
I wouldn't want to have him as my doctor, but then again, you don't really get to know your doctor, right? As you just said, the doctor is busy. I have exactly the same experience as you. The doctor's primary relationship is now between him or herself and the laptop, and spends most of the time focused on the laptop and the complicated software where he has to fill in all sorts of fields that are mandatory and that are probably completely irrelevant to whatever the patient is talking about, but they all have to be filled in. He's typing away, and once in a while, you might look over to the page. You feel like some sort of annoying appendix. It's kind of disturbance in the room. So yeah, the patient doctor relationship has really been destroyed or depersonalized. But you should ask, if you have a doctor, you should ask the doctor that question and see how they react.
I don't go to doctors anymore, but I had to.
That's wise.
I ran into my doctor in the gym, and he said, "You know, you really should get the COVID shot." And rather than laughing in his face, I said, "Oh, really? What are my odds of dying from COVID?" And he said, 1 in 400. And I looked at him because I know the numbers more than any doctor in this country, or I did 3 years ago. I knew them really, really well. It was 1 in 55,000, not 1 in 400. And even then, I'm in the gym and I'm wicked healthy. So he was totally didn't get it. So I wouldn't go to him, but then I had to go to the doctor for something. I forget what it was. And I didn't want to go to him. I said, "Just give me who you got." And they gave me this kid. I looked at him, I said, "You're a doctor?" He said, "Yeah." I said, "Oh, wow. I thought you'd still be in undergrad." I said, I said, like, "How old are you?" I said, "How long have you been a doctor?" So he said, 2 weeks.
2 weeks.
2
Okay.
weeks. He was 2 weeks out of residency, 2 weeks on the job. And then when he started writing down my stuff, he learned how to type without looking. He looked me in the eye the entire time. He understood. Great. He engaged me in conversation. I was like, this guy is not going to last. He's not going to last doing this job. He's too good. He's like an old school doctor at 28 years old or whatever he was. He was great. He was really good. And then I had told him a few things about COVID. He said, I'd really like to read that. I said, "Oh, I'll drop off one of my books someday." And I did. I went back and I dropped off a book for him and signed it. What a great guy. I was shocked.
Well, yeah, there are lots of great doctors. And with the I would think that with speech to translation, speech to text software has become so good that you can probably soon do away with the stupid laptop altogether and just have a speech to text system for doctors, so they can interact with their patient and talk, and it's recorded by, I don't know, probably, unfortunately, AI supported system that will suck the relevant parts out of the conversation and input them into into a document. But anyway, let's get back to the cases, because you had all these death certificates from Massachusetts, all of them, and you started matching them against the VAERS cases, and you discovered all this fraud on the death certificates. And what I found I knew about it already, of course, but what I found you really drive it home in your book, because you keep detailing the individual cases. Cassidy's case, the little girl that was 7 years old. Brianna's case, Diana's case, Eden's case, Daniel's case, all sorts of other cases. Many of these people are young. They're 7, 12, 16, 17, 30, 32. They're young people with their lives in the midst of life, or with their lives in front of them. And they were all killed by the COVID shots. And what you do in your book, so you go into these stories, and they're absolutely heartbreaking stories, every single one of them, absolutely terrible. And then you say, okay, so this case, for example, Cassidy's case, it happened in January. She died January 2022, correct? From the second shot.
Cassidy did,
yeah. Cassidy, 18th of January, I think, if I remember correctly, 2022.
Correct. Yeah.
But there were others who died earlier, who died in April 2021. Yeah. Young people, clearly from the vaccine, no doubt about it. And then you say in the book over and over again for each case, well, if, let's say, Brianna's case had been made public, if people had known that Brianna died, then this other person that died 5 weeks later, and it's all in Massachusetts, it's a small state, and who lived maybe 5 miles away or 20 miles away, this other person wouldn't have gotten the vaccine because they said, well, wait a minute, there was this case of Brianna, this young girl, and she died right after the vaccine or very shortly after. I'm not going to take that risk. Seems to be a dangerous proposition to take this vaccine. But since these cases were all suppressed, the media didn't report about it, people didn't know. And you keep building it up with every additional case. You say, well, now if let's say if Eden died after Brianna died. So if Eden had known about Brianna, then Eden wouldn't have died. But then, because Eden's case was also, nobody knew about Eden except maybe of course, the family, then other people, everybody else took the vaccine not knowing how dangerous it was. And this whole censorship, the not talking, making sure that people didn't know how dangerous the shots were, that is a crime of such enormous proportions that it's not surprising that people didn't suspect something like that could be happening, I think, at the time.
Yeah, I mean, that's the biggest question people have when they talk to me is, you can't be right because there's no way they could cover up something this big. There's no way that all these people will go along. There's no way. And I explain, because I just keep asking the question, why? I'm like a 2-year-old. Why? Why? Why this? Oh, because it's red. Why is it red? Oh, because it got ink spilled on it. Why did it get ink spilled on it? Just keep asking why. And then you get to it. And that's why I understand what happens systemically with doctors. I can tell you the behavioral modifications in that. And then when it comes to, let's just say, how can people possibly look aside when it comes to Brianna? So Brianna McCarthy, 30 years old, gets her Moderna shot, has a headache so bad within hours that she goes to the hospital. They turn her away and say, we're treating COVID patients. We can't treat headaches. Go home and take some Tylenol, which makes it worse. And so she went back again to the hospital because it hurt so much, and they turned her away again. And when she was brought back the third time, it's because her family brought her back to the hospital because she didn't recognize her sister. She was in a full-blown stroke the whole time. She ended up with brain lesions, paralyzed in half her body, and she died she's brain dead, as they say, in a few days. They took her off life support in a couple of weeks. And 6 doctors from Beth Israel Deaconess Medical Center in Boston and Harvard Medical College. So they were the 6 doctors that wrote the report about her specifically. It's entitled Fatal Post-COVID mRNA Vaccine-Associated Cerebral Ischemia. Translated to English, that means the vaccine killed her by stroke. Every paragraph says the vaccine killed her by stroke. They say where CVSTs, even though this is not, so she died from an ischemic stroke. They say in the report, while this is not a CVST, there are several reports of CVSTs from these vaccines where thrombocytopenia is frequent. So several reports and frequent. Later, they say there's a number of reports of thrombotic events, which causes both the CVSTs, the hemorrhagic strokes, and ischemic strokes, like Brianna had. And then in the conclusion, they say it's extremely rare. So they got a number of reports, several reports, frequent, and then in the end, they say it's extremely rare because that's the only way they could get it published. But to say that, they know. And only 2 weeks before Brianna was injected, Diane Dubois was 62. She died from, and it says it right on her death record, acute intracranial hemorrhage in the setting of thrombocytopenia in a person recently vaccinated for COVID-19. They say it, thrombocytopenia, and it says it in the report about Brianna that they know about it. Well, why didn't they look? And they didn't code Diane's for vaccine, which is Y59.0. So it says it on her death record that she died from the vaccine from a stroke, but it didn't get coded. It probably did get coded by the CDC, but they'd been deleting the codes to hide the vaccine deaths from the American people. That's another topic. But sticking to this one, 5 weeks after Brianna died, Eden, like you said, was 17. Eden McDonald, 17 years old, 20 miles away. You were right you even read the miles right. You have good retention for reading. I'm a terrible reader.
That was pure luck. I had no idea how many miles, but Massachusetts is a small state.
It's 20 miles away. In fact, Brianna died 5 miles from where I went to law school.
Yes, I remember that. I remember that. And you
Within a
said,
couple of weeks
yes. And
of them.
you said, and then your law schools told everybody they needed to get the vaccine and kicked you out for not getting it. So, I mean, if that had been, I mean, if something like this happens in Massachusetts, it's a small state. Again, it's not a huge state. If even one person dies and the media report about it, that's a big thing. The media reported about Cassidy's death. Parents were scared into they said, okay, Cassidy, 7-year-old, healthy girl, no problem. Well, maybe a little bit of asthma, but was a healthy girl apparently. She dies from COVID complications. She dies from COVID. Oh my God, I have to get my kids vaccinated. And that's probably the whole reason why why that was on her death certificate, so that more that they could vaccinate more kids, and that was exactly the effect that they wanted.
Yeah, they lied.
Which is just absolutely monstrous. It's absolutely horrifyingly monstrous. But I want to come back to the ICD codes because they're really interesting, and I didn't really know much about these ICD codes before I read your book. But it's very important to understand this, because you write that on the death certificate, the doctor or the medical examiner will write the cause of death, and there's a certain way of doing it, part 1 and part 2 and all this, but the doctor or medical examiner will not put the ICD-10 code. Now, ICD stands for International Categorization of Diseases, and it's an international system. So for the entire world, it's a global system that is managed and maintained by the WHO, by the International Health Organization, not by individual countries. So you really have a global organization. You have one point of control and one point of failure. Bad idea. The individual countries do not have their own classification codes, and the death certificate is, in the United States at least, is sent. You write in your book, it's sent to the CDC, and then they have a central parsing system where they feed all these death certificates into a software. So the software will match the words that are on the death certificate, the causes of death, to the appropriate ICD-10 code.
Yeah.
And yeah, so tell me about this, and tell me about the shortcomings of such a system.
Yeah. So a lot of doctors don't really understand how this happens, because in hospitals with living patients and in doctors' offices, in order for insurance to pay, they have to write down the codes. So for living people, they have medical coders that work in doctors' offices and also work in hospitals, and they write down the codes. So that's done for all the living people. But for death,
sorry to interrupt, but so it's not the doctor who writes the ICD code, even for living people. It's always some sort of medical coder.
Not always. I mean, doctors write them also. Yeah, but they have on staff, they have specialized medical coders in a hospital who will go around with the doctors, and the doctor will say it, and they'll put the code in. So the doctors don't have to memorize all the codes. These medical coders they have a lot of stuff in memory. But that doesn't matter. The point, I have death records. Okay, a lot of people don't realize the death records get sent from the states, exactly like you said. They get sent to the CDC. They have 2 software programs called Transax, 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 and ACME, ACME. And those 2 programs read the words, they parse the words, and they spit out the codes. And sometimes there's manual intervention needed. So they were caught. Aaron Hertzberg in New York and me and somebody else who wants to remain nameless, who kept saying, John, what about this? What about this? And I was like, leave me alone. And finally I looked at it, I was like, oh my God, she's right. And here's what happened. So I have records from Massachusetts, Minnesota, Connecticut now. In Massachusetts, Solomon Kizito died on January 16, 2021, 2 weeks into the vaccine program, or 2 weeks into that year, 21. Acute bronchopneumonia in the setting of thrombocytopenia. in a person vaccinated 11 days prior. So another thrombocytopenia. January 16, 2021, it goes through the software at the CDC, and either somebody manually coded it and added Y59.0, which is the ICD-10 code, which means viral vaccines. It's exactly what it says, viral vaccine. Okay, so you've got Solomon gets coded. The next, at that time, 9, now it's like 11, records that mention vaccine as a cause of death. And some say died of a heart attack 4 hours later, died of a pulmonary embolism 2 hours later. We know it's the vaccine. It says it on the death record. The death certifier wrote it there. They want it to be known. No Y59.0. It's not there. So either they manually coded the first one for Solomon, and then they refused to manually code the next 9 to 12 in Massachusetts. Either they did that, or the software actually did spit out the Y59.0, which I'm betting it did. And on Solomon's, it went through. But on the others, they delete it and they send it back to the states without the Y59.0. So somebody, I believe, at the CDC has been deleting Y59.0. And the only way to track these causes of death are by these codes. There's nobody looking at the words and putting hash marks and, doing stuff like that. It's done by codes. And so Y59.0 is missing. And in Minnesota, Aaron Hertzberg wrote an article in July of 23, I think it was. CDC has been fraudulently omitting vaccine as a cause of death from death records, something like that. It was written in the brownstone. And the article states the accusation that the CDC has not been coding them. And Greg Piper from Just the News, which is it's a smaller organization, but it's not tiny. I mean, it's a professional organization. So Just the News, Greg Piper calls up sends an email to the CDC, their public relations, and says, here's an article. They say you're committing fraud by omitting them. What comment do you have? And Kristen Nordland from the CDC, public relations, writes back to the effect of, oh, by the way, these are Minnesota records that the article was about. It wasn't about the Massachusetts that I just told you about, but that's important. I'll tie it together. So in that article, 3 were coded, 6 were not. And one of them was 10 hours later, and another one was minutes later. They were vaccine deaths, and they weren't coded. So she writes back, the article you mentioned is incorrect. Those records that are not coded say vaccination, and a vaccination is not a vaccine or cause of death, so they didn't get coded. And it doesn't say side effect of or adverse effect of, so they didn't get coded. Wow. And then she went on to say more stuff. So I'm like, wait a minute. She's trying to make the excuse they weren't coded because vaccination doesn't mean vaccine. And
I guess you could think of a better argument. That's the most desperate argument you can think of.
Cornelia, she tailored her exact response to the 3 that were coded and the ones that weren't. Like, what are different about these 3 than the others? She looked at the exact words. Side effect of was one of them. Adverse effect of was another. And they all used vaccine, not vaccination. So you use that excuse. Now that you know that, let's take a look at Solomon Kizito that was coded. It says vaccination, not vaccine. Doesn't say side effect of, doesn't say adverse effect of. She lied. Mm-hmm. Everything in that email was a lie.
Right.
And then I go and get Connecticut records. Micah Williamson was 16 years old. He died from cardiomyopathy from the vaccine. He was recorded as having died from the vaccine by the chief medical examiner of Connecticut, Dr. James Gill. Done. So the next 3 in Connecticut, not coded. That first one, coded. So you have 3 states in which the first one's coded, the rest aren't. The next one, 3 are coded, the rest aren't. And in Connecticut, the first one coded, the rest aren't. They stopped coding them. Why? They're hiding the vaccine deaths from the American people. And then I go and I look at the codes for the entire United States, Y59.0, there's 272. And then Sarah Meyer goes and testifies for the ACIP committee on June 25th, 2025, and says, All we know about are the 6 TTS deaths. That's it, from Johnson & Johnson only. Like, TTS, by the way, is thrombosis with thrombocytopenia syndrome. There's thrombocytopenia again. California alone has, I think it was, what did they come up with? 460. Yeah, 460 excess thrombocytopenia deaths since the vaccine came out. In California alone, they're lying about everything.
So you said that you found only 272 codes that coded actually for vaccine deaths.
Everything I do, I'm looking at codes, unless it's Vermont. Vermont gives us records without the codes. But so Connecticut, Minnesota, and Massachusetts give us the records with the codes. But how the codes got on the records is they went to the CDC, got coded, and got sent back.
Yeah, so I mean, it's absolutely clear from just this ludicrous number, 272 codes for vaccine deaths.
Well, as a deviation with regard to codes, an interesting one, because I have Minnesota, I have George Floyd. And because I have George
Oh,
Floyd's death record, it says on the death record he died from subdual neck restraint causing anoxia. I forget the exact words, but it said subdual neck restraint. But in the codes, you know what the underlying cause of death was in the codes?
tell me.
X42, which is psychodysliptics and hallucinogenic drugs. So fentanyl overdose.
Fentanyl, right.
The root cause of death for George Floyd was a fentanyl overdose. So imagine the state writes it down, it goes to the CDC, it gets coded as an X42, it goes back to the state then alters the main cause of death to be the subdual neck restraint, but they forgot to change the code.
What a criminal enterprise. Wherever you look, it's just criminal from start to end.
I don't even want to know most of this stuff. Like, just stop lying to me. Everywhere I turn is a lie. Just stop lying.
You would think that if there is the central thing that parses and matches and then attaches these ICD codes to death certificates, and then they are sent back to the states, you would think that a state would have a look and maybe, at least now, I mean, now they should definitely make sure that the ICD code actually matches what was on the death certificate, that they did it correctly.
It's too
And
much work.
if they find out that it's not done correctly, well, they can have their own parser just to see if it matches up the ICD code with the causes of death on the death certificate. And if it doesn't, then they should refuse having any death certificate parsed by this central machine that is sitting God knows where.
Look at this from human behavior perspective. Everything you just said, what should be done? Like, no, they're lazy. They're not gonna review it. What they should have reviewed it in George Floyd's case. That was a huge mistake not changing X42. That was a big mistake. But in general, no. I mean, they're too busy. Look at the people that go into working at government in the United States. You'll find that even in conservative states, the people that work for the state governments probably are Democrats, probably on the liberal side. I don't like the Republicans much better either, but I would say if I were to trust somebody, I trust a conservative more than a progressive.
When you think about this whole parsing thing with the ICD-10 codes, it's an interesting example of how easy it is to corrupt central authority within a state, or a state that has become extremely large and centralized. Because the way it should really be, when you think about the way this should work, is I would say it should work the following way. Let's say in Massachusetts, you have the doctor attending, the doctor that treated the patient. That is the person that knows most about the cause of death. That person has to sign off on the ICD-10 code. That person is the most competent to actually know if an ICD-10 code is the correct one or not, or which ones should be chosen. It can't be just sent somewhere and then sent back, and the doctor never even knows what the ICD-10 code is.
They don't care, and there's a big difference.
I would care if I were the doctor. I mean, if I write the death certificate and then I find out that they falsified it,
as long as their name's not on it. The electronic death record has the codes. They didn't sign the piece of paper, but the codes on it. The codes came back, and now it's electronic form. The actual certificate or whatever they got to sign, there were no codes. They didn't see it. But But also, Cornelia, don't forget, or at least I didn't say it yet. I think I say it in the book. There were different, even though it's centralized by the WHO and the CDC adopts a set of them, we don't adopt all of them. Like U12.9 means COVID-19 vaccine specifically. It's not used on death records. There are notations in the literature of England and Germany where they say there's an asterisk under U12.9, and it says that it's not really used much, and it's a subcategory of Y5 9.0. So that's why the CDC just uses Y5 9.0. But back to the differences in area. So even like Minnesota versus Massachusetts, Minnesota will have like 6 times as many AFib, atrial fibrillation deaths. Now, is that real? No, it's not real. All that is that's the dumping category that they like to write on death records as a custom and practice in the offices of medical examiners in Minnesota. So they'll write AFib a lot. And in Massachusetts, they'll write cardiopulmonary arrest a lot. And what does that mean? It means the heart stopped. Doesn't really mean much more. I mean, you die from pneumonia. The last thing that happens before death is your heart stops. They write cardiopulmonary arrest. But that's the go-to in Massachusetts. 70% of all cardiac category deaths are cardiac arrest in Massachusetts. And cardiac is the leading cause of death. It's like, that didn't cause your death at all. It just means your heart stopped.
Right. That's how we all die in the end. Or
Yeah.
if you're dead, your heart doesn't beat anymore.
All the literature is wrong, and if you aggregate them all, you can see trends and changes over time, and it's changes and inflection points. Like something happened. Now we should investigate what happened. But if you make a statement about specifically AFib or cardiac arrest or things like that, you're not going to get the same answer from state to state, country to country, because you think the code represents something that you think, in order to be certified as this, these things have to happen. That's a guideline. That's not a rule. The states do whatever they want. And when you have a culture form in an office culture, if you study organizational behavior and see one guy trains another guy, and that guy gets trained and he trains more people, and the change that one guy makes gets filtered down into the entire staff within 10 or 15 or 20 years, everybody's doing the same thing. That might be different from 1,300 miles away in Massachusetts. And so you have to go into studying the data with an understanding that it all comes from human behavior. And if you try to lump too many things together and aggregate too many things, you don't know all the errors that are in your data. Like if you say, 50 million people in the world died from vaccines because I did an analysis of all these excess deaths, how much of that is the Ukraine war, and how much of that is some famine in another continent, and how much you don't know that it's from the vaccine. You've aggregated too much data, and you can't make that attribution. So I just wanted to point out the difference that just because the WHO says this code means this, it doesn't mean everybody's using that code properly from state to state, nation to nation.
Yes, that's right, which means we need more people like you who do the same kind of work that you did for Massachusetts for their own states and really look at the data and try to get to the bottom of what happened. Now, I want to come back to the government censorship. We talked earlier about people not knowing in, let's say, the spring of 2021 or even February 2021. You write in your book that in February 2021, there was enough data in VAERS. I mean, as deficient as VAERS is with all its problems of underreporting and all sorts of stuff wrong with VAERS, but VAERS was still functioning well enough despite everything to give a really strong signal in February 2021 about the huge number of clotting deaths. All of a sudden, a huge increase in clotting deaths and in other things as well, but particular in clotting deaths. That was before someone like Richard Hirschman, the embalmer, found his first white fibrous structure, these white blood clots in one of his not patients but in his bodies. So that was really early on, and at that point, the whole enterprise. I mean, of course it wasn't stopped, but it should have been. People didn't know in April. People didn't know because nobody reported about it. Media didn't report about it. But I want to come back to this government censorship so that people really didn't know. You mentioned something interesting in your book. There is a FOIA document by America First Legal.
Oh, yeah.
They got an internal advisory issued by the CDC, and that was early. That was on May 12, 2021. That was after Diane had died from a stroke, after Brianna died from a stroke. Young people dying from a stroke. Yeah, it happens all the time, right? The CDC internal advisory stated, I'm going to read this. Be on the lookout, BOLO, be on the lookout for statements, pictures, posts, or messages containing misinformation about the eligibility of 12 to 14-year-olds for the Pfizer-BioNTech COVID-19 vaccine. It also states potential impact, reduced vaccine acceptance. And then, so this note was sent by a woman called Carol Crawford at the CDC to individuals at Facebook. And the presentation, you write, included examples of posts that the CDC wanted removed from Facebook. The body of the email coaches the email recipients on how to derogate VAERS, which is the CDC's own pharmacovigilance system. It's their own system, telling them how to derogate VAERS. Yeah, talk about that.
Yeah, so Stephen Miller had an organization, America First Legal. They did a FOIA, and they got these, and this is huge. And I don't understand why more lawyers and everybody didn't use it. I believe it was used in the Jay Bhattacharya case. Him and a few others in the state of Missouri brought against the CDC. But what happened? What you just read, Carol Crawford from CDC, there was an open portal between the CDC and Facebook. And in that portal, they would tell them, be on the lookout for, and they would give them examples. One of them was the vaccine affects pregnancies. If you read that, shut that down. And they were shutting down and censoring Americans all over the place. You couldn't write true things that happened in your life, that you knew people, even if you had a doctor's report, they would shut you down. If your son died, Facebook was shutting down people who were so vaccine injured that they basically wanted to commit suicide. They couldn't get out of bed. They had dysregulation problems with heartbeat, with breathing, just horrible things. They cut these people off from support groups on Facebook. They were talking to each other. Yeah, this happened to me. This happened to me. Oh, yeah. They shut these people down, disabled their accounts. A lot of these people committed suicide. Facebook is just, but they had to, because the federal government can control whether or not a company is broken up under the Sherman Act for antitrust violations. So if they don't want to be investigated for that and pay a bunch of fines, maybe be broken up, play ball with the government and do what we say. That's called fascism. It's a definition of fascism. And that's what they did. And so we were all censored like crazy. I gave up on LinkedIn first. That was the worst platform. The most censored was LinkedIn. I don't use it anymore. It's disgusting, that platform. Facebook was really bad. Twitter, if you remember, when Elon bought it, he found, I think there were 17 former FBI agents working in the legal department at Twitter, telling everybody to censor this guy, ban his account, suspend that account, don't let these messages out. If the vaccine works, what are they afraid of? Oh, they're afraid that we'll be lying? No, they're afraid because we're telling the truth, because the vaccine didn't work and it killed more than 500,000 Americans. And they, through this fascism and propaganda, they did that to Americans.
That's exactly right, because they were afraid of the truth, because so they had to turn the truth into disinformation, and disinformation becomes truth. But you said something interesting. You said that Facebook, there was an open portal between Facebook and the CDC. So what do you mean? What is this open portal? What did that look like?
Well, I'm not a software engineer, but an open portal is you can log in and send messages back and forth rather than just emails. So they probably had a system where they could send information privately back and forth. The I know that there were presentations made. In fact, I think that's included in Exhibit H in my case is the presentation between Carol Crawford and the CDC, and it has, be on the lookout for. It has some of these statements. I use that as Exhibit H in my case. It's all RICO, Racketeer, Influence and Corrupt Organizations Act, and that is the Federation of State Medical Boards. It's a non-governmental organization in the United States. They are like a group of all these medical boards. They have a lot of power. And the medical boards are like the American Board of Internal Medicine, American Board of Family Medicine, American Board of Pediatrics, radiologists. They all have their own boards. And the big ones, the American Board of Family Medicine, Internal Medicine, and Pediatrics, the three CEOs put out a statement nationally through their website. It's still there. It's a joint letter, a warning to all doctors in the country. If you spread vaccine misinformation, your board certification will be suspended or revoked. And they don't tell you what misinformation is. So they're basically saying, don't talk about the vaccine or we'll ruin your career. And that was through the Federation of State Medical Boards to those three CEOs who put out that memo. It's still out on the web right now. It's illegal. It's a felony, and they're still doing it every day.
Wow. Yeah, well, that's the technique of the Damocles sword hanging over you at all times. It gives you enormous leverage, and that's a sign of a totalitarian society or a tyrannical society.